My name is Mike Pappas. I'm a family medicine physician here in New York City and a member of Left Voice. This is one of the many hospitals in New York City that under Cuomo he's been trying to shut down. The nurses here on the front lines have been fighting against that for a long time. We're here as part of the National Healthcare Workers Day of Action. We're here representing the COVID-19 Frontline Workers Task Force at Mount Sinai. We are condemning the current for-profit healthcare system and how that system is broken and how it's always put profit over people's lives. I think it's important to recognize that while the system is broken, it's broken in terms of caring for the working class people of the United States and the masses in the United States. It's definitely not broken for the rich and for the capitalists who run the healthcare system. It was just announced in a press conference the other day by Governor Cuomo that healthcare workers in New York now are going to be getting one N95 a day. A hospital like this is one of those hospitals that was not getting the appropriate PPE, which put the frontline workers at risk, which means that they could spread the coronavirus to their families or they could spread it to other patients. I think it's important to note that even if those N95 masks make it to frontline healthcare workers, which is still up in the air whether that will actually happen, it wasn't because the government leaders all of a sudden their hearts opened up and they decided to make this decision. It was because of working class frontline healthcare workers like the nurses and physicians here who forced the government to act. It's important to note that in this coronavirus pandemic that Black and brown people have been predominantly affected by it. They're being more diagnosed and they're dying more rapidly than anybody else. That just speaks to the underlying racist nature that our society was founded on and the underlying racism that's embedded in our healthcare system, that's embedded at the core of the healthcare system. And we're only seeing coronavirus act as a magnifying glass on those disparities that already existed. The healthcare system has always been in the United States based on extracting profit from sick bodies. It's been based on putting profit over health at its core. What we really need is at the very floor, we need a Medicare for all system, a national improved Medicare for all system, but that is the floor. What we actually need is we need to nationalize healthcare. We need to nationalize all of the industries that have to do with health. So that means pharmaceutical industries, that means device manufacturers. They all need to be nationalized and they need to be put under democratic worker control. The workers know what's needed and the workers know how to run these systems themselves. We don't need executives there at the top acting as parasites to just get large salaries. Workers know what they need. The workers and the patients and communities can run these hospitals and these industries for themselves.